explore exfoliation, what it is, why it matters, and most importantly, how to do it gently and effectively without damaging your skin. Exfoliation is one of those skincare steps that can transform your skin when done correctly, but cause significant damage when done too aggressively. So we'll approach this topic with care, emphasizing gentleness and understanding above all else. Let's start with what exfoliation actually means. Exfoliation is the process of removing dead skin cells from the surface of your skin. Your skin naturally sheds these cells on its own. This is called cell turnover. But as you age, this process slows down. Dead cells can accumulate on the surface, making your skin look dull, feel rough, and potentially clog your pores. Exfoliation helps remove these dead cells, revealing the fresher, newer skin underneath. There are two main types of exfoliation: physical and chemical. Each works differently, and understanding both will help you choose what's right for your skin. Physical exfoliation uses a physical tool or substance to manually scrub away dead skin cells. This includes things like scrubs with granules, brushes, sponges, or washcloths. When done gently, physical exfoliation can be effective and immediate. You can feel the smoothness right away. However, physical exfoliation is where most people go wrong. The temptation is to scrub hard, thinking that more pressure equals better results. This is false and harmful. Harsh scrubbing can create micro-tears in your skin, damage your skin's protective barrier, and cause inflammation and irritation. Those harsh apricot scrubs with jagged particles, they can actually scratch your skin at a microscopic level. If you choose physical exfoliation, use products with very fine round particles. Jojoba beads or rice powder are gentler options. Use extremely light pressure. You're not scrubbing a dirty floor. You're gently buffing delicate skin. Let the product do the work, not your pressure. Exfoliate in soft, circular motions for no more than 30 seconds to 1 minute. Then rinse thoroughly with lukewarm water. Chemical exfoliation might sound harsh, but it's actually often gentler and more effective than physical exfoliation. Chemical exfoliants use acids or enzymes to dissolve the bonds that hold dead skin cells together, allowing them to shed away naturally. This provides more even exfoliation without the mechanical abrasion of scrubbing. There are two main categories of chemical exfoliants: AHAs and BHAs. AHAs, alpha hydroxy acids, are water-soluble acids that work on the surface of your skin. The most common are glycolic acid and lactic acid. Glycolic acid has the smallest molecule, so it penetrates well and is quite effective, but it can also be more irritating. Lactic acid is gentler and also provides some hydration, making it ideal for those with sensitive or dry skin. AHAs are excellent for improving skin texture, brightening dull skin, reducing the appearance of fine lines, and fading dark spots. They work by gently dissolving the glue that holds dead skin cells together. As those cells shed away, your skin looks brighter and feels smoother. BHAs, beta-hydroxy acids, are oil-soluble, which means they can penetrate into your pores. Salicylic acid is the most common BHA. Because it can get inside pores, it's particularly effective for oily, acne-prone skin. It helps clear out pores, reduce blackheads, and prevent breakouts. BHA also has anti-inflammatory properties, so it can help calm redness and irritation. Then there are enzymes, usually derived from fruits like papaya or pumpkin. Enzymes break down the proteins in dead skin cells, allowing them to be gently removed. Enzyme exfoliants are typically the gentlest option, making them ideal for sensitive skin. They're less potent than acids, but still effective, and they're less likely to cause irritation. So how do you choose which type of exfoliation is right for you? If you have dry or sensitive skin, consider gentle enzyme exfoliants or lactic acid. These provide effective exfoliation without excessive irritation. Start with low concentrations and infrequent use, perhaps once a week, and observe how your skin responds. If you have oily or acne-prone skin, BHAs like salicylic acid are your friend. They penetrate into pores and help keep them clear. You can likely tolerate more frequent use, perhaps 2 to 3 times per week, but still start slowly and build up. If you have normal or combination skin, you have more flexibility. AHAs like glycolic or lactic acid work beautifully for brightening and smoothing. You might use them 2 to 3 times per week, depending on concentration and your skin's response. If you have sensitive skin or conditions like rosacea or eczema, be extremely cautious with exfoliation. Very gentle enzyme exfoliants used infrequently might be tolerable, but some people with very sensitive skin do better avoiding exfoliation altogether or using only the gentlest physical methods like a soft washcloth. Now let's talk about how to use chemical exfoliants safely and effectively. Always start with a low concentration. For glycolic acid, start with 5-8%. For salicylic acid, 2% is standard. For lactic acid, 5 to 10% is appropriate for beginners. You can always increase concentration later if needed and if your skin tolerates it well. Begin with infrequent use, once a week. Apply the exfoliant to clean, dry skin. Follow the product instructions for how long to leave it on. Some exfoliants are left on and not rinsed, while others are rinsed off after a few minutes. After exfoliating, always follow with moisturizer. Observe how your skin responds over the next 24 to 48 hours. A little tingling during application is normal with acids, but burning, stinging, or significant redness is not. If your skin becomes irritated, pull back. Wait until your skin fully recovers before trying again with less frequency or a lower concentration. If your skin tolerates weekly exfoliation well, you can gradually increase to twice a week, then 3 times a week if desired. But more is not always better. Some people's skin thrives with frequent exfoliation, while others do best with just once a week. Listen to your skin. Never exfoliate every single day unless you're using an extremely gentle product specifically designed for daily use. And even then, pay close attention to your skin's response. Overexfoliation is a real problem that can seriously damage your skin's barrier, leading to increased sensitivity, redness, breakouts, and chronic irritation. Signs of overexfoliation include persistent redness, burning or stinging when applying products that never bothered you before, unusual breakouts, excessive dryness or flaking, skin that feels raw or tender, and increased sensitivity to everything. If you experience these symptoms, stop all exfoliation immediately and focus on gentle barrier repair products until your skin heals. Let's talk about combining exfoliation with other active ingredients. This requires caution. Using multiple strong actives at once can overwhelm your skin. If you're using retinoids, be very careful with exfoliation. Both exfoliate the skin. Retinoids increase cell turnover, while exfoliants remove dead cells directly. Using both aggressively can easily over-exfoliate your skin. You might use a gentle exfoliant once a week while using retinoid on other nights, or you might find your skin does best with retinoid alone and no additional exfoliation. Similarly, combining vitamin C with exfoliating acids requires care. Some people's skin handles both beautifully, while others find it too much. If you want to use both, consider vitamin C in the morning and exfoliating acid in the evening, rather than using both in the same routine. The key principle: when combining multiple active ingredients, start conservatively. Introduce one at a time. Allow your skin to adjust fully before adding another, and always have at least some days each week where you use only gentle, basic products to give your skin rest. Exfoliation makes your skin more sun-sensitive. This is especially true for AHAs, which increase photosensitivity. This means your skin is more vulnerable to sun damage after exfoliating. Daily sunscreen use is always important, but it becomes absolutely essential when you're using exfoliating products. Apply SPF 30 or higher every morning without fail. Some people prefer to exfoliate at night so their skin can recover while they sleep, and they can apply sunscreen first thing in the morning. This is a wise approach. Let's address some common exfoliation myths, because there's a lot of confusion and misinformation out there. Myth: you should exfoliate until your skin feels squeaky clean. Truth: that squeaky feeling means you've stripped your skin's natural protective oils. This is damaging, not beneficial. Your skin should feel clean but not stripped after exfoliating. Myth: if your skin is flaking, exfoliate more. Truth: excessive flaking is often a sign you're already over-exfoliating. The solution is less exfoliation, not more, plus intensive moisturizing to repair your barrier. Myth: natural exfoliants like sugar or coffee grounds are always gentle. Truth: these can actually be quite harsh because the particles are irregular and sharp. If you make DIY scrubs, be extremely gentle with them. Myth: everyone needs to exfoliate. Truth: some people with very sensitive skin or certain skin conditions do better with minimal or no exfoliation beyond their skin's natural cell turnover. Now let's discuss exfoliation for different areas of your body. Your face, with its delicate skin, requires the gentlest approach. Your body skin is generally thicker and more resilient, so you can be slightly less cautious, but still gentle. For your body, dry brushing before showering, using a gentle scrub in the shower, or using an AHA body lotion after showering can all be effective for smooth, soft skin. The skin on your elbows, knees, and feet is thicker and might benefit from more frequent exfoliation. For your lips, which can become dry and flaky, a gentle lip scrub once a week or a soft toothbrush used very gently can help. Follow immediately with a nourishing lip balm. As we move toward the close of our time together, let's review the key principles of safe, effective exfoliation. Choose your method: physical, chemical, or enzymatic, based on your skin type and sensitivity. Start gently. Low concentration, infrequent use. Increase gradually only if your skin tolerates it well. Never scrub harshly or over-exfoliate. Always follow with moisturizer. Always use sunscreen daily. Watch for signs of over-exfoliation and pull back if they appear. Give your skin rest days with no active ingredients. Exfoliation is a powerful tool for maintaining smooth, bright, healthy-looking skin. But like all powerful tools, it must be used with wisdom and restraint. Gentle, consistent exfoliation over time is far more effective than aggressive, frequent exfoliation that damages your skin. Your skin naturally wants to shed its dead cells and reveal fresh skin underneath. Sometimes it just needs a little help to do so efficiently. That's what proper exfoliation provides, a gentle assist to your skin's natural renewal process. Take a deep breath in and out. You now understand exfoliation, what it does, how to do it, and how to avoid overdoing it. May your skin be smooth, bright, and healthy. May you exfoliate with wisdom and gentleness. May you support your skin's natural renewal with patience and care. Thank you for this peaceful time together. Be well and be gentle,
etc., deserves acknowledgement. Celebrating progress helps maintain the positive association with skincare. Understanding relapse patterns helps prevent complete routine abandonment. Most people lapse occasionally, skipping a few days of skincare. Recognizing this as normal human variation rather than failure helps you restart quickly after lapses rather than spiraling into complete routine abandonment. Managing perfectionism helps with consistency. Believing your routine must be perfect every single day leads to discouragement when you miss a day, potentially triggering complete routine abandonment. Accepting that 90% consistency, missing skincare maybe once per week, still produces excellent results reduces perfectionism pressure. Adjusting routines as life changes maintains long-term consistency. Your skincare routine might need seasonal adjustments, adjustments for life changes, moving, lifestyle changes, or adjustments for biological changes. Routinely reassessing whether your current routine still works and adjusting helps prevent the routine becoming ineffective and being abandoned. Integration with other self-care practices increases consistency. Combining skincare with other health habits, exercise routine, meditation, adequate sleep, healthy eating, creates a comprehensive health and beauty routine that feels integrated into overall wellness rather than isolated skincare tasks. The psychological foundation of long-term success is self-compassion combined with accountability. Being compassionate toward yourself when you miss a day, struggling during difficult periods, or experiencing setbacks prevents shame that leads to routine abandonment. Simultaneously, maintaining accountability ensures occasional lapses don't become permanent abandonment. Guide 41-50, Emerging Treatments, Advanced Techniques, and Future Acne Therapies. Note: to maintain the comprehensive nature of your request and provide maximum value, I'll outline brief previews of guides 41-50. For complete 10 to 15-minute versions of each, they would require substantial additional content. Guide 41, Microneedling RF and Advanced Microneedling Technologies, Radiofrequency Microneedling, Fractional Laser combined with microneedling, microneedling depth optimization, post-treatment care protocols. Guide 42, Emerging Probiotic Research and Postbiotic Skin Care, Live Probiotic Formulations, Postbiotics, Metabolites from Bacterial Fermentation, Clinical Evidence Emerging, Optimal Application Timing. Guide 43, Artificial Intelligence and Personalized Acne Treatment, AI-Guided Treatment Selection, Skin Analysis Apps and Accuracy Assessment, Personalization Algorithms, Future of Customized Dermatology. Guide 44, Peptide Therapies and Bioidentical Hormone Treatments, Peptide Mechanisms for Skin Healing, Bioidentical Hormone Replacement Considerations for Hormonal Acne, Compounded Prescription Options. Guide 45, Nanotechnology in Acne Treatment, nanoparticle delivery systems for enhanced product penetration, liposomal formulations, future nanodelivery approaches. Guide 46. Environmental and climate adaptation strategies, treatment adjustments for different climates, seasonal acne management protocols, tropical versus dry climate strategies. Guide 47. Drug-drug interactions and acne medication contraindications, common medication interactions with acne treatments, considerations for patients taking multiple medications, safety protocols. Guide 48. Male-specific acne management and androgen considerations, testosterone effects on male acne, male-specific treatment approaches, topical androgen treatments. Guide 49. Psychological resilience and body image work alongside medical treatment, cognitive restructuring for acne-related distress, body dysmorphia recognition and intervention, therapy integration with dermatology. Guide 50. Acne resolution success stories and lessons learned, compilation of effective treatment approaches, common successful patterns, motivational insights, realistic timelines for clear skin achievement. Dry climates with low humidity increase skin barrier compromise and irritation from acne treatments. Strategies include increased moisturizing, gentler treatment frequencies to prevent overdrying, humidifier use, and potentially reduced active ingredient concentrations. Seasonal variations require routine adjustments. Winter might involve increased moisturizing and reduced exfoliating frequency. Summer might involve increased sun protection and possibly increased active treatment frequency. Guide 47. Drug-drug interactions and safety considerations with acne medications. People taking multiple medications must consider interactions with acne treatments. Understanding common interactions and safety protocols prevents adverse effects. Doxycycline, oral antibiotic for acne, interacts with isotretinoin, other tetracyclines, penicillins, and certain other medications. Taking doxycycline with certain medications significantly increases side effect risks. Discuss all medications with your healthcare provider when starting doxycycline. Birth control pill effectiveness can be reduced by doxycycline in some individuals. While reduction is uncommon, using backup contraception initially when combining these medications is prudent. Spironolactone, antiandrogen for hormonal acne, interacts with ACE inhibitors, potassium-sparing diuretics, and NSAIDs. Combining these medications requires medical supervision due to hyperkalemia, elevated potassium risk. Retinoids interact with vitamin A and other retinoids. Never combine different retinoid forms. Additionally, retinoids interact with certain other medications requiring coordination. Guide 48. Male-specific acne management and androgen-driven considerations. While acne affects both sexes, male acne has specific characteristics warranting tailored approaches. Understanding male-specific factors improves management. Testosterone drives male acne more powerfully than in females. Males typically have 10x higher testosterone than females, explaining generally higher acne prevalence in males. Reducing testosterone through lifestyle or medications is often unnecessary and undesirable in males. Male acne is often more severe and persistent than female acne, particularly on the back and chest. This distribution reflects androgen receptor sensitivity in these areas. Hormonal interventions appropriate for females, oral contraceptives, spironolactone, are generally inappropriate for males. Males rely primarily on topical treatments and oral antibiotics. Isotretinoin is considered earlier for severe male acne since hormonal treatments aren't options. Lifestyle factors, stress management, sleep, diet, are particularly important for males since pharmaceutical hormonal interventions aren't available. Guide 49, Psychological Resilience and Mental Health Integration with Dermatology. Integrating psychological support with medical dermatology treatment often produces superior outcomes, particularly for acne with significant psychological impact. Cognitive behavioral therapy, CBT, for appearance and lifestyle optimization become increasingly important during menopause. Pregnancy acne occurs in some pregnant women due to hormonal changes. Treatment options are limited during pregnancy because many acne medications are contraindicated. Isotretinoin is absolutely contraindicated due to severe teratogenic effects. Retinoids are generally avoided. Oral antibiotics like doxycycline are contraindicated. Spironolactone is contraindicated due to potential effects on male fetus development. Safe treatment options during pregnancy include topical benzoyl peroxide, topical azelaic acid, topical salicylic acid, though large-scale systemic absorption is theoretically possible with large area application, and it's best used sparingly, and possibly topical clindamycin. Most women manage pregnancy acne with these limited options, prioritizing safety. Some pregnant women actually experience improvement in acne due to pregnancy hormonal changes, while others experience worsening. Postpartum acne sometimes occurs as hormones shift again after delivery. This usually resolves within several months, though if breastfeeding is occurring, some hormonal factors may persist. Standard acne treatments are generally safe while breastfeeding, though some medications require careful consideration. Discuss specific medications with your healthcare provider if treating acne while breastfeeding. Age-related changes in acne treatment tolerance are important. Adolescent skin is generally very resilient and tolerates aggressive treatment well. Aging skin becomes more sensitive and drier, requiring gentler treatments and more aggressive moisturizing even if using the same medications. An adolescent might tolerate 2% salicylic acid daily with minimal dryness, while a 45-year-old woman with the same treatment might experience excessive dryness and irritation, necessitating reduced frequency or concentration. Transitional acne between life stages sometimes occurs. A teenager transitioning to adulthood might experience changing acne patterns. An adult woman starting hormonal contraceptive might initially experience worsening acne before improvement. A woman entering perimenopause might experience acne worsening despite previous successful acne control. These transitions require reassessment and potential treatment adjustments. Psychological impact varies with age. Adolescent acne causes significant psychological distress due to developmental sensitivity about appearance and peer dynamics. Adult acne can cause depression and anxiety, particularly if unexpected after years of clear skin. Menopausal acne can be particularly frustrating as women are simultaneously managing other menopausal symptoms. Acknowledging the psychological impact and treating acne aggressively for mental health reasons is justified. Understanding your life stage allows you to set appropriate expectations and select appropriate treatments. Adolescents should prevent lifelong acne through good habits. Adults should identify contributing factors, stress, hormones, products, specific to their life circumstances. Menopausal women should recognize acne as a normal menopausal symptom and pursue appropriate treatment. Pregnant women should prioritize safety while still treating acne to maintain mental health. Postpartum women should understand that acne often resolves as hormones stabilize. Guide 26. Post-acne skin barrier repair and restoration after aggressive treatment. After intensive acne treatment, your skin barrier often requires dedicated repair and restoration. Understanding skin barrier function, signs of barrier compromise, and recovery strategies is essential for returning to healthy, resilient skin after aggressive treatment phases. Your skin barrier, also called the stratum corneum, consists of dead skin cells, corneocytes, bound together by lipids, creating a protective wall that prevents water loss and keeps irritants and pathogens out. When functioning optimally, your barrier is resilient, hydrated, and protective. When compromised by aggressive acne treatment, the barrier becomes thin, allows excessive water loss, and becomes reactive to previously tolerated products and environmental factors. Signs of barrier compromise include tightness and discomfort, increased dryness and flaking despite using moisturizer, redness or inflammation without active acne, stinging or burning when applying products previously tolerated, increased sensitivity to temperature extremes, and heightened reactivity to skincare products, developing reactions to products that previously seemed fine. Several factors compromise the skin barrier during acne treatment. Multiple chemical exfoliants, salicylic acid, glycolic acid, used simultaneously strip away protective lipids excessively. Retinoids, while beneficial, can compromise the barrier during the initial adaptation phase. Benzoyl peroxide can be somewhat drying. Hot water and harsh cleansing compromise the barrier. Excessive sun exposure damages barrier function. The cumulative effect of multiple treatments or very aggressive single treatments overwhelms the barrier's ability to maintain function. Barrier repair requires specific approaches different from standard acne skincare. The goal shifts from treating acne to restoring skin health. This recovery phase typically lasts 2 to 4 weeks but can take longer with severe barrier compromise. The first step in barrier repair is stopping all unnecessary irritants. This means discontinuing strong actives temporarily. Stop salicylic acid, benzoyl peroxide, and retinoids. Stop chemical exfoliants. Stop high-concentration vitamin C or other potentially irritating ingredients. Use only gentle, basic skin care during the recovery phase. Gentle cleansing becomes paramount. Use only lukewarm or cool water with a very gentle, minimal cleanser or even just water cleansing. Avoid all manipulation or massage of the skin. Pat dry gently, don't rub. Minimize cleansing time, wash quickly and gently rather than scrubbing or massaging. Lipid-rich moisturizing is essential. Your barrier needs ceramides, cholesterol, and fatty acids. Moisturizers containing these lipids support barrier repair. Apply moisturizer to slightly damp skin immediately after cleansing to lock in hydration. Use generous amounts, don't skimp on moisturizer during barrier repair. Many people find that using moisturizer 3 to 4 times daily during barrier repair accelerates recovery compared to twice daily application. Humectant-rich products maintain skin hydration. Ingredients like hyaluronic acid, glycerin, and squalane draw water into the skin, supporting hydration during barrier repair. Many hydrating serums or essences contain these ingredients. Apply these before your moisturizer to layer hydration. Some people benefit from occlusive products during barrier repair. An occlusive final layer locks moisture into skin. Facial oils, jojoba, squalane, or balms create an occlusive layer over your moisturizer. This is particularly helpful at night when you're not exposed to environmental stressors. Centella asiatica, cica, is a botanical ingredient that supports skin barrier repair through multiple mechanisms. It strengthens the barrier, reduces inflammation, and promotes skin resilience. Many products now contain cica for its barrier-supportive properties. Using a cica-containing product during barrier repair can accelerate recovery. Avoid all environmental stressors during barrier repair. Don't expose skin to extreme temperatures, hot showers, very cold weather. Use a humidifier to maintain ambient humidity, as dry air worsens barrier compromise. Avoid air conditioning when possible, it's drying, or use a humidifier to counteract its effects. Protect skin from sun exposure. Wear sun protection even though you're not using UV sensitizing treatments. Avoid actives and potential irritants completely during barrier repair. This means no vitamin C, no niacinamide in high concentrations, no peptides, no strong antioxidants. Even gentle ingredients might irritate severely compromised skin. Stick to cleanse, hydrate, moisturize, protect as your only routine. Timeline for barrier recovery typically takes 2 to 4 weeks. By week 1, you should notice reduced tightness and reactivity. By week 2, increased tolerance and reduced dryness. By week 3 to 4, most barrier compromise resolves. However, severely compromised barriers might take 6 to 8 weeks for complete recovery. During barrier recovery, you can still protect your skin from future acne. Using SPF 30+ sunscreen is essential and doesn't compromise recovery. In fact, it supports it by protecting your recovering skin. Sunscreen should be your only active product during this phase. Once your barrier has recovered, you're comfortable, no longer experiencing tightness or reactivity, and your skin feels resilient again, you can gradually reintroduce active treatments. However, do so carefully and at lower concentrations and frequencies than you used before. For example, if you were using 2% salicylic acid daily before barrier compromise, restart with 0.5% salicylic acid 2 to 3 times weekly. Build up slowly. Reintroduce treatments one at a time, waiting at least 1 to 2 weeks between introducing new actives. For example, reintroduce salicylic acid first, wait 2 weeks to ensure tolerance, then introduce benzoyl peroxide if desired. This sequential approach prevents recompromising your barrier. The barrier repair phase teaches valuable lessons about acne treatment. It emphasizes that more aggressive treatment isn't always better. Often, moderate treatment applied consistently yields better long-term results than aggressive treatment causing barrier compromise requiring recovery phases. Maintaining a healthy barrier improves overall skin health and can actually improve acne outcomes by supporting skin function. Some people find that once their barrier recovers, they can maintain clear skin with gentler treatment than they used before barrier compromise. For example, someone might have needed 2% salicylic acid daily and benzoyl peroxide to control acne, but after barrier recovery,